y'all, it's your girl Nurse Bree back again, and this is my second video, and I'm so excited that y'all are actually watching this with me and learning. And your girl has been a full nurse for like 3-4 weeks now, but I'm excited because I wanted to come back and basically talk to you guys about my first month as a nurse. It's been overwhelming. Basically, I'm a part of a nurse residency. It's a year long, but I have a 2-year contract. So that means for that first year, I'm basically in a residency where I'm paired one-on-one with a nurse, and I have to learn. They basically like hold your hand. And then for that second year, I can either stay on that same unit that I did my residency on, or I can go to a different unit in the hospital, but I can't leave. That's the whole point of the contract. Some nurses do, but I plan on staying where I'm at. I love my hospital. And so basically, my first week was just orientation, guys. It was like 5 days a week, 8 hours a day of just straight up videos and PowerPoints. And that is probably the most tired I have been compared to a 12-hour shift. That's probably the most tired I've been because we're not doing much. We were learning a lot, but I'm very hands-on. I have to be hands-on with things, and that's how I learn. But some people do learn through PowerPoints and, you know, someone talking. So maybe that was, you know, beneficial for someone else, but for me it didn't work. So we got through that first week. I was relieved about that. So going into my second week, that's when I was actually paired with the person that was going to be training me, my preceptor. And I was very nervous because I'm thinking, like, how are we going to mesh? Are we going to mesh well? Am I going to learn a lot? And then what if I don't like her? Like, I don't want to go tell my manager that I'm not really learning much because I still got to work on the floor with this woman. So to backtrack a little bit, for the first 10 weeks of my nurse residency, I actually have to be one-on-one with someone. I actually follow them around and they show me step-by-step how to do everything. I was actually very excited about this as well because I learned hands-on and I asked a lot of questions. So, point on point, ask a lot of questions, y'all. Never be scared. Never feel like you're going to be dumb. Even when I was in nursing school, I used to sit in the front of the class. My teachers knew I was going to ask a question. I always did. My biggest pet peeve is just not to know something. Like, I have to know everything. So anyway, my first week on the unit, quote unquote, with my person, it was kind of overwhelming because I'm on an internal medicine med surg floor. And we can have up to like 5 or 6 patients. 6 patients on a bad day, 4 patients on a good day, but 5 patients is basically steady. It's about 4 nurses on our unit and 1 charge nurse. And everyone knows, like, if you're a charge nurse, you're not really getting a room. You're only getting 1 room because the charge nurse just kind of jumps around to make sure everyone else is okay and they manage the floor. And so for my first week, I get towards that. And I only work 3 days a week, guys. So that's 12-hour shifts, 3 days a week. And that's the whole point of my residency. They don't want to burn us out because, you know, you get that new money. You like, oh, let me add an extra day or 2. Like, no. The max I can work is 3 days. The least I can work is 3 days. So I have no choice but to work 3 days, 12-hour shifts. I already was accustomed to doing 12-hour shifts. But what I was not accustomed to was working 7 a.m. to 7 p.m. I'm a night owl, so I love 7 p.m. to 7 a.m. And let me prepare you guys about what a day shift is. The doctors come and talk to you, the family
and friends come and talk to you, PT talks to you, occupational care talks to you, then you also got to talk to pharmacy, and then you got to call surgery, and then you have...
it was... And being in my 3rd week on the unit, but 4th week as a nurse, it was just like time management is real. And I thought I was like really good on time management, but that first week really allowed me to figure out I need to make a timesheet, and I'm actually going to post a link on my example of my timesheet. With my first week, by the end of my 3rd day, I had my first patient. My first patient was really cool and got accustomed to how to pull drugs, time management, using the computer system, and that was good. I felt like I had a good flow of that because I only had 1 patient. So then on to my 2nd week, I had 2 patients, and every week they want you to increase. So by the end of my 10 weeks, they want me to have and handle 5 to 6 patients by myself without any help, really. But you know, you can still ask questions all the time. Also, with my residency, I'll be doing 5 weeks on day shift and then 5 weeks on night shift. And so I think I have about 2 more weeks left on day shift, and then I would get to go to my night shift, which I'm kind of prepared because it's way smoother, it's more chill. So anyway, on my second week, I was like, okay, bro, you got to get it together. Like, I really wanted to impress my preceptor, and I wanted to impress myself to know that I can handle 2 patients this week. I can do this. And mind you, I used to be a nurse assistant when I was in nursing school, but what I was challenging with it during my second week was delegation. And basically delegating is I can't do everything by myself. So I had to learn to go and ask and be like, hey, I have to pull meds by this and this time for this patient. Can you please go change them for me? Or, hey, can you help me do a bath at this time? Does that work with you? Because I may have a total patient. And a total patient is someone who needs total care. They need help with feedings, washing their body, changing them, things of that sort. And so delegation was a big thing for me. What I have learned, guys, and when you start nursing, nurse assistants are your best friends. You better be cool with them folks because they'll be the ones to help you when you in the weeds with your patients and you need to go get changed, or they need to get up and go to the bathroom, or you have a confused patient and they just won't sit still and you kind of need one-on-one attention with them, but you also have to take care of your other patients as well. So my second week, I decided I have to get myself together. And so I made a sheet. And I don't know if you can see it well. I'll post the link of it. But basically, I put from 8 a.m. all the way down to the end of the day. I have my date, my unit, and these boxes right here are for my patients. And in each area, I put down what medications are due, when they are due. Sometimes, depending what medication it is, I also put down when they need to be repositioned, when their blood sugar is due. I may also put down when I need to request certain continuous fluids that I don't have access to on the unit. I also put down possibly when I can go to lunch and when I can take a break, when I see there's a good gap. So I think that would be very important. It helped me a lot. It helped me organize my day so that I'm not just, after taking report, I'm not just going in there like blinded and trying to hurry up and get all my tasks together and figure out what I want to do. Another thing that I had learned on my second week is I got to get to work early. I don't clock in until 6:53, but we do have shift huddles at 6:30. So I try to get to work around 6:15, look at the patients that I'm assigned, and I start just kind of going through their chart so I can pick out certain things that I feel like is important, and I add it to my report sheet. And so then I know I can talk to them. I also use this. I don't take these into my patient's room, but I think they're really good because you have the little clipboard on the top, and then you can also open it and you can put your little papers in there. I keep sticky notes a lot. This is my report sheet as well. I'll post a PDF of this, and it just basically has on there the different systems and how it relates, if they're on nasal cannula, all of those things. I also made my own little sticker part for privacy. But guys, I think that would be very important. Also, I made sure that I had my calendar. It's very important to have a calendar, guys. I bring this to work all the time. It keeps me very organized on my shifts, anything that could have any changes. So for my second week, I came strong. I was like, y'all not about to catch me slipping. I had my report sheet set up. I had my activity sheet set up for throughout the day. So then I'm going to my third week, guys. I'm not gonna lie, I was overwhelmed the first day. I was very overwhelmed because I wasn't that prepared. I didn't get there at 6:15 like I had planned. I got there at like 6:20, 25. And so we jumped straight into our meeting that we have, with the previous shift, and went straight into report. And I was not prepared. And let's just talk about it. We're dealing with the coronavirus. And so we have patients on our floor who are either positive for it or they're getting tested for it. And so that was a hassle as well because we actually have to go into the patient's room and give a report in front of the patient. So having to put all the PPE on, take it off, wash your hands, then go to the next room, get a computer. It was just overwhelming. Then the doctors were already kind of making their rounds this early because of the coronavirus. Families are asking questions. I was very overwhelmed. And so later on during the day, like noon, I actually had my little flow. I was using my sheet. So actually, I've only had 2 days this week. I have one more day this week for my third week. But so far, yesterday was really good, guys. I got to work early yesterday. I had my report pre-read pre-written. I didn't have that many questions to ask. I just needed to know what was the update. I was on top of my fluids. Like, I was able to call the doctors without being nervous. And so basically, I just wanted to encourage y'all that if you're a new nurse and you're stepping into a new environment, a new hospital, and you're learning, just ask a lot of questions, prepare yourself, make your own report sheet that works for you, get a task list. Hopefully the one that I have helps you. That helped me a lot. And get you a calendar, sis or sir. It keeps you on track, so you already know that you're prepared. You got this. I have one more day ahead of me. I know I'm gonna do great. It's gonna be lit. Love you. I'll be back with a third video soon.